Dr. Leonardo is a board-certified plastic surgeon, GMDVA Assistant General Secretary, DIUP Doctor Innovator Facilitator. He works as a plastic surgeon in the southern city of Blumenau, Brazil. He was passionate about innovation and the transformative potential of plastic surgery in the lives of many patients. He graduated from the Catholic University of Pelotas and was considered by the Rectorate Team one of the most influential leaders of his generation for his role in advocating for changes in the student curricula. In 2010, he worked as a professor in the University of Blumenau, FURB, and championed the creation of the Plastic Surgery League at FURB. Keen about using the ideas of Toyota model and design thinking, considered a design thinker for many problem solving and team management approaches. This year, he co-founded LADUO, Co-Creation of Health. In 2012, he published a paper about the co-creation of the concept of health together with patients, which was awarded Best Scientific Article at the Plastic Surgery meeting. He believes in the role of the practitioner as a supervisor and together with a multidisciplinary team that supports the patient on his individual choices that should aim at better quality of life and well-being. So Dr. Leonardo, I will just pass on the presentation rights to you, and you should be able to share the screen now.
Hello, good morning from Brazil. It's really a pleasure and an honor to be here. I will try to share my screen, and it's a really honor to be here with you all. And most of all, I would like to thank the opportunity from the commission and from my colleagues. And most of all, this slide, it's like was inspired by Dr. Al-Hussana, previous speak. Then when you were asking him about artificial intelligence and how artificial intelligence is helping us to improve our healthcare decision making. It's how artificial intelligence is helping us to analyze data, make decisions, and exercise judgments. But I would like to give 2 steps backwards to understand that artificial intelligence is a tool that uses some criteria to take a decision. And us as human beings, how are we using some criteria to lead the digital transformation of health and even in surgery? So I would like to present you some criteria that I personally use in my works and the people that I work together. I like to show you, to introduce you the AAA criteria is when you improve the patient experience, better outcomes, and when you lower costs. It was developed in 2007, and this criteria was improved to if we add clinician well-being. So when we are choosing a startup, when we are developing new technology, when we are developing a new product, if this new product, new criteria improve the patient experience, has better outcomes, lower the costs, and even improve the clinician well-being, for me, it's a good technology, it's a good software, it's a good product, or it's a good service. So last year, there's another point that we call the quintuple aim for the healthcare improvement. It's when we are talking about health equity. So right now, we are using these 5 points, 5 criteria to make decision and how we choose the best technology and how we choose the best service or product to improve the patient's experience. And I would like to give you a question to let this first question. How might we improve our decision-making process using this quintuple aim as the main criteria? To understand this, to improve our decision process, we must understand 2 steps to understand how digital transformation is working, is transforming digital patients, digital journey, digital care, and even digital therapy. When we are talking about digital patients, biomarkers, we can understand that our body generates data 24/7, and everything that can be measured can be improved. So we are developing for the patient an analytic, preventive, and predictive mindset for the patient, but even for the doctors and the whole ecosystem, whole health ecosystem. And when we are talking about the digital patient journey, the digital patient journey mostly starts when they Google, they're researching something, and then Google, or maybe all these tools of researching tools, was the first digital touch point. And then right now, after the pandemic, the patient has a completely journey without leaving his home, having researching, having telemedicine, diagnostics, prescription buying, having experiencing, and even advocacy for the doctors. So every step of this journey can be, and right now is, a digital touch point. And every digital touch point could be a digital scientific endpoint. That's the great idea of this presentation. And you can check on DIUP, the Digital Medicine Society, you can check their library, the library of digital endpoints. So they are studying a lot of digital endpoints for the patient digital journey that could be scientific proven, scientific studied. So there's a lot of disease like diabetes, sickle cell anemia, liver disease, asthma, chronic cough, COVID, diabetes. So we have a lot of digital endpoints that are being studied for this patient journey. So what's happening right now? We are having a new digital care cycle that is safe and effective because we are having science on every step of this journey. So we are having digital patients, digital journey, telehealth, remote diagnosis, digital prescriptions, pharmacy therapeutics, and monitoring. But how safe and effective is the digital care cycle in your country right now? How safe is the complete digital care cycle in your country? I really appreciate this slide, this picture from Orca, that they say that more than 5 million people download a health app every day, more than 5 million people. But how safe and effective are these apps? How safe and effective are this software or this service? They say that only 20% of these digital health products meet the standards, and that's the opportunity, and that's the global new contest. Wearables as a medical device and software as a medical device, for example, the digital therapeutics, are just now being regulated all around the world. For example, in Brazil, we have the first wearable as a medical device regulated 2 years ago in May 25, and the software as a medical device, the regulation just started few months ago. So I would like to ask you, how is in your country? We were having a nice webinar that I invite you all to participate with Dr. Naoko Okada from Japan, and she was explaining that in Japan, they just started the regulation of these digital tools or digital therapeutics. And she was even telling a history about her patient, some patients that come to her with a lot of patient data and asking her, doctor, how safe are this data? How can I improve? How can I improve my health using this data? And it was really interesting to understand how it is happening in Japan. Dr. Meraj was speaking how it's happening in India. So I invite you all to participate in our webinars to understand the global movement. And right now, what I'm trying to bring to you is that this new digital care cycle that is starting with real world evidence, giving a virtual care delivery, and we are changing from disease management and therapeutics to this virtual care delivery. So everyone, this completely digital care cycle right now, it's moving to metaverse. So that's the point. We are about to understand how we can study, create, and identify these digital metaverse endpoints, and in a interoperable network, and most of all, how we are developing and leading this new change from this digital care cycle, from this digital safe and effective care cycle to digital metaverse care cycle. That's why I'm here right now, looking for potential partners to understand how these new technologies like AI, blockchain, all the platforms that we are presenting right now, how can we are working together and avoid this disruptive stress that for the doctors and for the patients that cannot connect all these tools. And the main objective is this, to deliver future value for the patient through innovation and data, and how we can use this 5 quintuple aim criteria to lower costs, better outcomes, improve patient and clinician experience, and even provide health equity. So to have this magic formula here working on the health ecosystem, we identified, we as a participant to TEMP, and a lot of friends that are still watching, David, Fion, Dr. Hussana, Dr. Vincenzo, and Dr. Skinovsky that will speak after me. We understand that the main cause of digital lower pace of receiving and adopting new technologies is because the doctors are not upskilled enough. So we understand that doctors need to be upskilled and need to understand how they can use new technologies to improve the patient experience, to improve his experience as a doctor, how we can use all this data collected to improve our experience. That's why right now we are upskilling doctors in digital health innovation. In one of our main projects was this digital upskilling project that we worked with 57 doctors from 31 different countries, and we worked this year, and we have 4 modules that were interconnected all together, just to bring the doctor inside the co-creation of these tools, creating innovative mindset, human-centered digital health literacy, digital tech application, and by the end, we created this action-based proposal creation. And it was amazing that the doctors creating their prototypes and even creating the specific glass for robotic surgery using VR and using artificial intelligence, and even using artificial extended reality to improve the experience as doctor, to improve the ergonomic experience. As you can see in this picture, they are showing this hand picture. They are showing how ergonomic this could be, the position of the glass, if it was above, or if it was center, or if it was low, and how it can improve the ergonomics. So it's really important right now to bring the doctor and the patient to co-create the solutions. And that's, for me, it's the main gap in all the industry all around the world. So how might we lead this digital transformation of health and even surgery, as Dr. Al-Hossana mentioned before? Because even in surgery, we have a lot of opportunities to improve not only the technical aspect of the surgery, for example, in robotic, using glass, looking down, looking straight, or looking above, or the position of the arm, but during the entire journey of surgical patient, even diagnostic, or even when we are taking care of post-op journey, and how can we impact their journeys and co-create a value-based journey, a value-based we can say treatment for diabetes, for asthma, for COVID, for anything we want. But first of all we can understand how to understand every step of the journey, measure every step of the journey, see if these steps are safe and effective, and how we can improve. And so that's why I'm asking you right now how we can co-create new globally scalable digital health companies that are safe and effective, and how can we collaborate in synergy inside a robust ecosystem right now. Thank you so much. I'm open for questions and open to talk a little bit more. Thank you so much.
Thank you so much, Dr. Leonardo. That was a very informative session. We'll give the audience a minute to ask any questions that they have. So, Dr. Leonardo, one question that we have is that doctors already are having very busy schedules and very busy lives. And then they're also expected to get themselves acquainted with the advances in technology. So they want some advice from you and tips as to how doctors can make time, or how can they accommodate learning technology.
Thank you so much. As I am a surgeon, I have the same problem, and I even have a young children. And how do I say? The most valuable resource that we have right now, it's our time, it's our lifetime. And they had a research and asked the doctors and the surgeons what they would have done differently and when they are retired. And the most of them said, I would spend more time with my family and more time with my children. And I always have this in mind. So when we are using technology, the fourth criteria of quintuple win right now, it's how we can improve the doctor experience to be as a doctor. Because right now, not only having lack of time, right now I would add another layer of thinking. Right now, all the doctors and all around the world, we are having burnout, we are extremely stressed, and we are having extremely a lot of trouble that we didn't have before. Because I am a plastic surgeon. Right now, I have to deal with the problems of patients with COVID. There's no the materials, there's no enough materials, there's no prostheses, and there's no sufficient operation room every day. So we have new problems that we didn't have before the pandemic. So the short of time is even bigger. If we as a doctor can receive value, understand that when we use technology, we can have more time with our family, more time to take care of ourselves. That's the main aspect. So how we can do this? First of all, we have to find time in our agenda and block this time in our agenda just to study. For example, we have every Thursday morning, we have a meeting with GMDVA committee, and we have blocked in our agenda time to understand how we can save time later. So in this beginning, it's really difficult to save time, but we have to put in our agenda one specific time. And this period, I will study, I will participate to DIUP programs to understand how I can use technology to improve my experience as a doctor, to improve my patients' lives. So when we are delivering value to our patients, so we can charge more, the patients are perceiving our service as more valuable, they pay more or the service or the community or the government pay more for our service because we have better results, and then we can, after work less to receive the same amount. That's what I'm looking for. That's what I'm thinking about, how we can have, for example, as value-based practice, in, of course, in proportionally to everyone. That's the point. How we can do this to receive more, to being perceived, for patient to perceive it as more valuable our service. Because as a doctor, we have to understand how to deliver a good service for the patients.
Absolutely, absolutely, Dr. Leonardo. Another question we have is, what are your thoughts on introducing knowledge of artificial intelligence, virtual reality in medical school itself, rather than later on when it gets a little more difficult, I suppose?
Oh, thanks a lot for this conversation. And how do I say? My generation, we are living this digital transformation. I learned to study. I love books. I study a lot of books. When I was doing medical school, we have 90 colleagues, 90, almost 100 colleagues. Only 3 girls have computers in my room during the 6 years of medical school. But now the kids start using computer since they are 3 or 4 years old. And I think that if we can understand how we can use their abilities, I don't know if for gaming, or I don't know for robotic, I don't know if, but how we can introduce them in this digital world in a controlled way, and using them to understand and how to practice medicine, I think it's much more useful than just to, by the end of the faculty, by the end of the residence program. Now, when they are working, they start using these new tools. I think as faster we bring the students together to even develop new technologies, it will be a faster adoption of innovation. That's the point. How we can improve the adoption of innovation. Great.
Absolutely. Absolutely. Thank you so much, Dr. Leonardo. That was the last question we had for you. Thank you so much for taking the time. I know it's a little too early over there. It's very kind of you to make time for us. It was wonderful listening to you.
Okay, thank you so much. I'm really happy to share my presentation with you all, to see all the reference. Thank you so much. See you soon. Bye-bye.
Bye-bye. Thank you.